Hello everyone, my name is Niyaz Mahdavi, and you are listening to the Young Minds Magnified podcast. Today we'll be having a guest, a psychologist, who will be sharing their perspective related to how COVID-19 is affecting teenagers mentally. The psychologist for today's episode will be analyzing this topic in a general way, and then she will be analyzing the case provided in the previous episode in more details. Basically, she will be doing an analysis of the situation mentioned in the previous episode, and actually, I was the one that shared my experience and provided my perspective in the previous episode to how COVID-19 affected me mentally. Therefore, in other words, she will be analyzing my case. I highly recommend you watch the previous episode where I share my experience to know exactly what is happening, though the psychologist and today's guest does provide a good enough explanation that will make sense even if you do not do so. Hopefully you like this episode and the perspective of today's guest. I think that you will find her experience very valuable since she is very experienced, especially when it comes to her career. Therefore, I would like to share with you my interview with Dr. Taheri. Hello. First of all, I would like to thank you once more for participating in today's episode. I would like to ask you, how are you? How are you doing?
Hello. I thank you for inviting me to take part in your project. I'm feeling great and I'm very well, thank you.
That's great. If it is possible, please introduce yourself for those listeners who might not know you.
I'm a health psychologist. I work with adults and adolescents, and I've been working for the past 15 years in a hospital setting, working with patients who have chronic health condition and chronic pain. And I also have my private practice alongside of my hospital work.
I think that it is definitely clear that you are very experienced and have a lot of experience in your career in psychology in general. Therefore, I think that your perspective especially will be very valuable, and it can be very useful for a lot of others. If it's okay, I would like to start by asking my first question, which is pretty vague, though I think it is still necessary to ask this question to be able to actually understand your perspective as a psychologist. And the question is, what are the most common problems teenagers face that affect their mental health?
The most common problems teenagers face with their mental health is acceptance. Even the most self-assured teenage person may struggle with acceptance from time to time. And it's kind of hard for them due to their lack of maturity to accept themselves. The parental acceptance is very important for them at this stage, and there is a significant link between the children's psychological adjustment and how they perceive the parental rejection. The other thing that is a concern is stress. The pressure the teenager face from school, from parents, from their peers can create ongoing stress patterns for them. If they are struggling with school or friendship, that will make it extra hard. So it's important to help them to establish healthy boundaries and to teach them how to prioritize and to simplify life, and how to create a safe atmosphere at home is important. And also it's important to talk about their feelings quite openly. The other thing they may struggle is depression and anxiety. And there are some links with depression and social media. And it's crucial for parents to watch for any warning signs of depression and anxiety in their teenagers and to seek help if necessary. The other thing that they struggle with is self-harm. Unfortunately, teenagers sometimes they face lots of pressure and temptation than ever they dreamed before. And not only they may go towards using substances like drugs, alcohol, but they can also get tempted to self-harm. And it's important to open their eyes about how they can improve their coping strategies and how they can reach out for help. The other issue that they may struggle with is bullying. There are lots of anti-bullying programs nowadays, but teenagers are quite like the teenagers are very likely to face bullying on a daily basis from their peers, and it needs a lot of attention.
Now, I would like to redirect us to the topic of this episode, which is how is COVID-19 affecting teenagers mentally? And I think you can agree the pandemic has quite literally affected every single person in the world right now. Therefore, it is not surprising that it affected teenagers in a way as well. Therefore, I was wondering, what are the most common reasons as of why teenagers are experiencing stress during COVID-19, based on the cases that you've dealt with and your experience?
The COVID-19 crisis has taken its psychological toll on people of all ages. But one group especially that has been affected is the teenagers. School closures, lack of social contacts, social distancing have cut off many teens from their major means of psychological support, putting them at high risk of developing anxiety and depression. Teenagers might have tried to avoid their experience of these emotional difficulties. And it's been important to help the teenagers to recognize that their anxiety is completely normal, and healthy function. It might be difficult at this time. And it's important to say to them that their anxiety is going to help them to make a decision that they need to be making right now, and not spending time with other people or in large group or washing their hands and touching their faces. It's necessarily a bad thing, and these can help them to keep them safe, and also others to keep others safe. This is also how we take care of the members of our community, and we think about the people around us too. Whilst the anxiety around the COVID-19 is completely understandable for teenagers, we also need to make sure that they know how to use the reliable sources to get the right information, or to check any information they may need so that they can get the information through the right channels. It's also important to help the teenagers to create distractions. What we know is that when we are under chronically difficult conditions, it's very helpful to divide the problems into different categories: things they can do something about and things that they cannot do something about. And there's a lot of falls under the second category right now, and that's okay. But one thing that helps us to deal with that is creating distraction for the teenagers. Suggestions are like doing homework, watching a favorite film, or getting in bed with a good book as a ways to seek relief and find a balance to their day. The other way that they can find a way to help themselves is to find new ways to connect with their friends. Now, spending time with friends for teenagers is important, but the social distancing is different. So social media is a great way to connect, and also sort of encouraging them to stay in touch with them and to help them to stay focused on themselves and how they can start maybe to learn something new, like reading a new book or spending time to practice a new musical instrument, focusing on themselves and finding ways to use their newfound time in a productive way can help them to look after their mental health.
I can say that everything you have mentioned is definitely true, though I would like to share with you a more specific case and ask you to analyze it, which is my case. In the previous episode, I shared my experience with COVID-19, where I explained how spending a lot of time with myself caused me to overthink a lot of things and to have a lot of negative thoughts. And I especially became very sensitive and felt on edge about almost everything. And I was wondering, is this a common issue for teenagers? And why does this occur?
Yes, in some ways, it is quite common an issue amongst the teenagers um, to have a lot of negative thoughts during COVID-19, and they can become very sensitive and feel on edge about everything because they may feel quite isolated on their own and being away from their social contacts and from their friends. So this is very important, as I have said in my answer to the previous question, for teenagers to find a new focus where they can find a new way of living and being productive with the time they have in their hand rather than focusing on negative thoughts. Distraction always does help.
Finally, I would like to ask, what are some recommendations you would give for teenagers being affected by COVID-19 in such ways?
My recommendations for teenagers being mentally unwell by COVID-19 is to definitely seek psychological support, to be open about how they're feeling with their family and their friends, and to seek relevant supports, and also to create healthy distractions for themselves and to try to be productive with the time they have on their hands, and to introduce and implement some relaxation techniques in their daily life routine. I think it's also important for the teenagers to have daily goals and have a weekly activity schedules so they can be a bit more organized with the time that they have on their hands and to be goal focused. Thank you.
Thank you so much for your time. As I have mentioned a lot, your answers are genuinely very valuable, and I would like to thank you once again for sharing them. Thank you for listening to the Young Minds Magnified podcast. I would like to thank today's guest, Dr. Taheri, once more for participating in today's episode. If you like this episode and would like to listen to more episodes discussing similar topics and situations, you may check out our YouTube channel and Facebook page, both Young Minds Magnified. Thank you for listening, and I hope you enjoyed this episode.